Hi folks, it's Dr. Rob CYWES. I'm the Carb Addiction Doc, and before we get into today's video, I just want to say thank you so much to folks that throw us a few dollars at our Patreon account and especially at our PayPal account. The addresses are in the show notes below, but that keeps this channel free. We break even. It's all done under a charitable organization. I receive zero revenue from this, but we've got certain overhead costs, and I really appreciate those that feel compelled to donate because the content resonates with you. Thank you so much for that. However, even if you're not willing to throw money at us, which I absolutely understand, you can help us by subscribing to this channel and by liking the videos or even leaving a comment. And if you see some of our videos popping up on your feed, click on it for a few seconds. That raises the visibility of these videos for yourself, for others, and it helps us to generate revenue to keep me going, to keep these videos free. But thank you so much for your support. And I know that your support comes because these videos resonate. And my mission is to continue to educate, continue to get you to think. Even if you disagree with us, if I've made you think, I've done my job. Thanks so much. And now to today's video. Hi folks, this is Dr. Rob CYWES. And for the next several videos, we are going to discuss the pros and cons of a carnivore diet. And today's video is all about the benefits and possibly some risks related to starting a carnivore diet. The next video will be very much more pragmatic about how to get into it and the pros and cons of doing carnivore. So, and then we'll go through some of the subsequent ways to monitor the benefits. But first of all, let's talk about the benefits and the risks. Anytime you are looking for a change, you're looking, okay, I want to change my diet. I've heard about this carnivore diet. It is almost always predicated on one of two things. Either you've got certain health issues or certain issues that are bothering you and you're looking for a way to improve or get rid of those problems, or you may be doing pretty well, but you want that jump up. So the first stage of getting into a carnivore diet, and this is crucial, the first stage is the contemplative stage, where you are thinking about it, you're researching it, you're going to hear the good stuff, you're going to hear the bad stuff. Some of it may be plausible, some of it may just be idiocy, both pro and against. So there's a contemplative phase that everybody goes through, and I think that is a crucial thing because it is a massive change. And it's a massive change in practice in your day-to-day routine that we're going to give you guidance on in subsequent videos. So the first important benefit of thinking about starting a carnivore diet just lies if you're thinking about a carnivore diet, you are automatically thinking about living a healthier lifestyle, benefiting yourself, getting rid of health issues, and improving your general quality of health, both in terms of your mind, your body, as well as your overall general happiness. Now, it comes at a cost because at first we have to let go of certain things that are habits, that are attachments for us. So the way I look at starting a carnivore diet, it's like climbing a mountain. And here's the caution. Here's a very, very important caution. Never, ever jump into the deep end of a pool if you don't know how to swim. So if you're coming from a standard American diet, your neighbor, your buddy, your family member is doing carnivore, they've said it's a wonderful thing, do not start with a carnivore diet. It's too radical a change. Your body doesn't do well with it. The way I look at it is if you take your car, your gasoline car, to a gas station, to a petrol station, and oh my goodness, the price of petrol and gas is just too expensive, I'm going to put diesel in my engine. You put diesel in a gasoline car, that engine is going to break down. It's not going to work well. However, if you say, look, I'm looking at diesel as an option, you take your car home or to a mechanic and you rebuild that engine over time, then you come back and you put diesel in, it's going to function well. Exactly the same with conversion. So the first pitfall is don't go from a standard American diet or a Western diet, a high carbohydrate, low fat diet, and jump in the deep end of carnivore. You won't do so well and you'll abandon the diet. There's an adjustment period metabolically for your body. So I would start by slowly eliminating carbohydrates in your diet, slowly start to reduce by category the carbohydrates in your food. So maybe you get rid of the mashed potatoes. Maybe you get rid of the Diet Coke and you change to water, coffee. You get rid of the real Coke and you go to the Diet Coke, or you go to the artificial sweeteners or Gatorade Zero, or you go to water, or you go to coffee. Make some changes to your drinks first. Make some changes by category. Okay, I'm going to eliminate potatoes from my diet, but I'll keep the rice and the pasta. Eventually, I'll eliminate the pasta. You slowly make changes, but you keep the vegetables, and then slowly you eliminate that. Remember, carnivore is a way of life, not something you suddenly do for 2 weeks like diets. It's radical, and what you're really trying to do with a carnivore diet is to transform the way your body works on a hormonal level. It's not about sudden weight loss. It's not about suddenly doing anything. It is a strategy that we use to improve our health, to get rid of health issues, and to improve our health. And as a strategy, it requires a slow transformation. And I would set a daily or a weekly transformative change for a month or two until you get to carnivore. And the next discussion will be how to design that carnivore diet, but slowly get there. Slowly eliminate carbohydrates. Then you start to eliminate some of the vegetable products, and you slowly introduce fat and a greater percentage of animal product in your diet. And you can also discover, I like this, I don't like that. At the same time, try to avoid listening to evangelistic influences on the internet. You're always going to find those radical people out there that are only eating ribeye steaks every day. That may work for them, but it's a horrible place to begin with. And it may not be a good place to even end up with. So be very cautious about listening to practical and pragmatic advice rather than the evangelist that you must do this, you have to do this, this is so terrible for you. They're basing their advice on what works for them, and what works for them doesn't necessarily work for you. So that's one of the key things. Now, let's go into some of the benefits of a carnivore or carnivore-based diet and moving that way. First of all, sit back and evaluate where you currently are. Get blood work done, get some cardiovascular studies done, and have those tests analyzed by somebody who understands them from a biologic perspective, not in the context of the current algorithm-based medicine doctrine that is heavily lipophobic or afraid of fat as a diet. Have them analyzed pragmatically and see where you are. And if there are health issues related to this, if your hemoglobin A1C is a little high, or you're pre-diabetic or diabetic, if you have excess weight, that's an easy one you can self-analyze. If there are issues with your heart, if you are concerned that you don't have adequate muscles, all of these things, if your testosterone levels are low, if as a female you've got cycle abnormalities, these are all health issues related to a disease that you've caused called insulin resistance. And if you have any evidence of insulin resistance, either by looking at your blood work or by looking at the consequences of insulin resistance, whether it's a risk of Alzheimer's or cognitive impairment or brain fog or fatigue, whether it's overweight, whether it's the diabetic stuff, whether it's cardiovascular, whether it is sexual function, whether it is normal cyclical gynecologic function, whether it is kidney disease, there are kidney stones, other kidney diseases. There are so many different forms of expression of insulin resistance, but they can be measured in your blood work. When you look at insulin levels, when you look at blood sugar A1C levels, if you have insulin resistance, a carnivore or carnivore-based diet is the single most effective way to not only get rid of insulin resistance and become insulin sensitive, but also to cross over and be super healthy in a state of insulin sensitivity when you formulate your carnivore diet correctly down the road. So the greatest benefit, the greatest health benefit, is the correction of insulin resistance, which almost everybody on a high carbohydrate has, whether it is obvious in a disease state or not, but it can be biochemically measured. So the first thing is to transition away from insulin resistance and become insulin sensitive, and thereby, through that mechanism, indirectly correct or stabilize all the other health issues that you have. Most of those are reversible or reversible to a great extent, whether it's Hashimoto's, whether it is thyroid disease, whether it is diabetes, whatever that may be. But stabilizing and possibly reversing or putting those diseases into remission, including high blood pressure, that's the first huge benefit. Then there are benefits to improving health. So even if you're moderately insulin sensitive, there is an improvement in health by being pure carnivore. There is a reduction, potentially when it's well formulated, in what we call futile cycles in the body, where the body is having to burn off excess fuel, or you are stressing certain biologic processes, even if they're not causing harm. Remember, the first level of protection of the human body are those biologic cycles that can be ramped up tremendously or ramped down. Burning excess fuel off as heat. Just like you see when you look at any refinery, they've got that tall tower with a flame on top. They're just burning off excess heat that should be going toward generation of electricity or whatever it may be. Well, your body does the same thing. So you may not see obvious diseases, but your body may be running these what we call futile cycles where it's burning off excess energy. And a carnivore or carnivore-based diet helps tremendously to do that. Changing the fuel of your body from being glucose-based to being fat-based has enormous advantages on your body in terms of prevention of certain diseases, a reduction in your risk of acid reflux-related diseases, LPR, acid-related diseases, an improvement in your gut function. Even if you don't have clinical inflammation or irritable bowel syndrome, there's an improvement. A reduction in cancer risk, a reduction in cognitive impairment. Now, you may not know you have cognitive impairment. You may not know that you're at risk for cancer because those diseases haven't expressed themselves yet. However, a carnivore diet has a measurable reduction. It doesn't negate it, but a measurable reduction in the triggering of those diseases. It's difficult to measure the absence of a disease. And I can assure you that a carnivore insulin-sensitive based diet is your best way to reduce the evolution of those. Do they occur? Of course they do. But they occur at a much lower rate and much more manageable when the foundation of your way of life is such that you are able to mitigate against them. Remember, we all have certain genes that express for certain diseases. And here's the interesting thing. Our genetics loads the gun, but our lifestyle pulls the trigger. And what we're talking about here is altering the lifestyle irrespective of the genes, rather than just trying to mitigate the genes. So the lifestyle is one that is less apt to pull the trigger. It's kind of putting that safety on the weapon if you've ever shot a gun before, so that it's less likely to go off. And I know that's a difficult concept for some to understand, but that's the purpose of the carnivore diet. What other direct benefits? So we've talked about the insulin resistance and the improvement in your health. Well, if you're an athlete in any way, shape, or form, a distance athlete, a specific athlete, if you are even endeavoring to do certain, play certain games like chess, that's one of the big ones. Could be snooker, it could be billiards. Any games that you play, building puzzles, your ability to focus, the acuity of your concentration, your memory, your muscle memory, or at least your, not muscle memory, but your brain memory, is more acute on a carnivore diet. So there's an acuity of thinking, there's less lateral movement, there's an increased ability to focus, and there's a chemical reason for that. So there are advantages both for intellectual requirements to focus. For example, as a surgeon, I have to be very focused. The carnivore diet and being in ketosis helps me to do that. If you're an athlete, improved muscle function, improved muscle performance over time, and improved recovery comes from a carnivore diet. Your use of glucose and glycogen as a fuel source is less on a carnivore diet, and you're able to perform better at a higher, faster, better level, and there is an improvement in your recovery. Now, there's no surrogate or substitute for repetitive training. If you don't practice, a carnivore diet isn't suddenly magically going to be a surrogate for that. But it enhances everything you do in that regard once you slowly get there. There's always a reduction in performance when you transition. If your cells are used to burning sugar and you're living on a high sugar diet and suddenly you go carnivore, there's a reduction in that because the cells are not used to the new fuel source. But slowly they get better. And that's why I mentioned that slow transition to carnivore rather than an instantaneous transition. But performance is better. If you suffer from low testosterone, cycle abnormalities, erectile dysfunction, low libido, carnivore will address that. Not in everybody, but there will be an improvement. There's always an improvement in testosterone levels in males, in correction of polycystic ovarian syndrome, in correction of gestational diabetes and some of the diabetic effect. There is an improvement in libido, which is both psychologic as well as physical. So, and for a lot of people, spoken or unspoken, those are huge advantages. A lot of people have sleep disturbance, and there are numerous factors that factor into that. But when you're feeling better physically and you are functioning better, your quality of sleep improves on a carnivore diet. And in addition, if you do lose a little bit of weight, if you do lose some of the fluid in your upper airway, your obstructive sleep apnea improves. Even if you don't have measurable sleep apnea, there's a reduction in that level of obstruction from the thick and soft tissues that carry a lot of water. Your quality of your sleep betters. Now, here's an important concept. On a carnivore diet, the required length of sleep is often shortened. You may get from 6 hours of high quality sleep the benefits that you get from an 8 to 9 hour sleep where the quality isn't that good. So don't, on a carnivore diet, look at the length of sleep, but look at the quality. Are you refreshed when you wake up? And you most likely, for the most part, will be better off in that direction. Is it nirvana? Is it kumbaya? Not necessarily, but there's always an improvement in sleep. Along with an improvement in sleep comes an improvement in mood, more of an optimistic outlook. You're more proud of yourself. You have more ways to offset against emotional tension by self-affirmation that yes, the effort to do carnivore is paying off, that you're seeing positive results, and that you can approve of the effort you're putting in, irrespective of the outcomes you're getting. And that improves your mood, makes you more optimistic, makes you generally more content and happier in life. It helps with disorders anywhere from anxiety and depression all the way through to bipolar and a variety of psychiatric and psychological issues. Even if you don't think you have them as a problem, most people on a standard high carbohydrate diet have emotion management issues. And a carnivore diet does improve those, particularly if you allow yourself self-affirmation and you're excited about the way you're doing it and what you're eating rather than feeling awfully deprived. If you start carnivore and you feel deprived of things you're not eating, that's not going to help you. But if you're excited and proud of the changes you're making, yes, requiring effort, your mood and your optimism changes, and there's a mental happiness and a mental contentment that comes into this, and you become more and more optimistic about taking the risk of trying new exciting things. You may take the risk of travel where before you found 10 reasons not to. You may take the risk of being physically active or starting to learn to play the piano. I don't care what those are, but you take positive risks that benefit you overall in terms of your mood, and it lifts depression. So it's a huge, big deal. The other part also is that you are more likely, I know this is bizarre, you are more likely to think of physical activity and do opportunistic little bits of physical activity as well as intentional physical activity on a carnivore diet. The whole genre lends itself toward exercise. And if you're doing that, there are benefits to being physically active, not only physically as you redirect what you're eating toward your muscles and toward other organs in your body, away from your liver and your fat cells for storage. So physical activity also helps to direct the direction and flow of what you're eating on a carnivore diet, and it's essential for that, and we'll talk more about that in other episodes. But the benefits there are toward a more physically active lifestyle that has enormous benefits irrespective of what your current limitations are, either limitations by weight or musculoskeletal limitations, bad back, bad knee, whatever it is. You're still going to find ways to be more physically active. So there's a subliminal focus on that. So the benefits of a carnivore diet personally are enormous. And then there's one other fallacy that I want to dispel in terms of the benefit side. Eating carnivore benefits the planet. The vegans love to say, oh, carnivore is producing all this methane gas and blah, blah, blah. Eating animal products that were raised as a food source, and there are certain animals that we raise as a food source, benefits the planet tremendously in terms of recycling. Far better than eating and disposing of plants. Less death when you are on a carnivore diet as opposed to a vegetarian vegan diet. Again, if you consider all life rather than just the life of a few fluffy mammals. But generally, the regenerative nature of the animals that we eat, especially if they're more pasture-raised or wild-caught, is enormous in terms of positive recycling. So don't let the political agendas of folks that are plant-based contaminate the absolute science behind carnivore eating being better for the planet. And then the final aspect is this. When you're on a carnivore diet, cost per meal may be a little higher. Cost per meal may be a little higher. But if you take all of your meals and all of your eating over the course of a day or a week, and you analyze the cost relative to the cost of a standard American diet or a high carbohydrate, low fat diet, the overall spend on food on average is way lower than spending that same amount of money on processed crap. So always understand that the poorest people can actually afford a healthy carnivore diet better than they can afford the crap that you live on a processed food diet. And I'm happy to break that down for you. So there are multiple benefits to a carnivore diet with very, very little downside. Quite frankly, the biggest downside of a carnivore diet is the way that it is formulated. And in the subsequent videos, we're going to give you specific details about how to formulate a carnivore diet so that it is healthy, cheap, and best for you. And we're going to discredit some of the gum flappers out there that have their own personal agendas that, oh, this is the way I do things, therefore you must emulate them. Because the biggest mistake on a carnivore diet is to follow the advice of people who do not understand how your body works, or people that are eating carnivore for their own purposes that don't align with yours. But a well-formulated carnivore diet from several different categorical perspectives related in further videos is going to be the healthiest, best diet for anybody as long as you are human. So if you've said, I tried it, it didn't work, there's a reason that didn't happen. And it's all good. But you got to also understand why it didn't happen for you. And if you want to try again, understand how to get there. And the first thing is get there slowly. Contemplate, prepare and plan, and then slowly implement it. Don't start it on day one, and don't be too austere in a carnivore diet. I am the Carb Addiction Doc. If you want to know more about this, follow the next several videos in this series.